Now to a CBS News investigation into the cost of caregiving. More than 70% of the nation's nursing homes are now owned by for-profit companies, often companies with backing from private equity and real estate investors. And there's new research raising some troubling questions about the quality of the care at these facilities. CBS News contributor Lisa Ling first encountered those questions through her own family's experience, but she soon discovered they are not alone. Lisa, good morning.
Good morning, Tony. Good morning, everyone. Last month, we introduced you to my 92-year-old mother-in-law, Grace Song, in our Cost of Caregiving series. After she was hospitalized for an infection earlier this year, Grace spent a month in a skilled nursing facility, part of an American nursing home sector that we found has become increasingly profit-driven.
This is Berkeley East, a for-profit skilled nursing facility in Southern California, where my 92-year-old mother-in-law, Grace Song, spent a month earlier this year.
When you go through all this stress, I'm just so deadly tired.
I began recording her during my visits after she told me she struggled to get the attention of staff, and medication she says she was told to take promptly at 8 a.m. routinely came hours late.
So then you're starting to panic because so much time is
passing by. So I was pushing the buzz to find out what's going on.
One night, my mother-in-law, who was a fall risk, was left alone in the bathroom and fell. She hit her head and was sent back to the ER.
This is where you feel, how did I get to be so helpless?
More than 70% of U.S. nursing homes are now run by for-profit companies, and there's growing evidence patients are paying the price. Harvard professor David Grabowski is an expert on nursing home policy.
The vast majority of quality problems in the U.S. are centered in for-profit nursing homes.
Most U.S. nursing homes rely on taxpayer money from Medicare and Medicaid. Grabowski told us as profit-seeking investors have poured in, it's become more difficult to track where the money goes.
We really don't know kind of how they're using public dollars and whether they're actually going into direct resident care.
New research suggests within the nursing home industry, extracting profit through inflated rents and management fees is widespread. Meanwhile, many of these facilities have been found to have lower staffing and worse quality of care. In 2019, Berkeley East was taken over by a for-profit company called Aspen Skilled Healthcare, a mid-sized chain of more than 24 nursing homes.
How often were you exposed to examples of gross negligence?
It felt like on a daily basis.
This nurse, who asked to appear in shadow, left Berkeley East after working there more than a decade. She was one of 5 current and recent former employees who told CBS News patient care had been compromised after Aspen took over.
What would you say the biggest changes were?
When we tried to call upper management, they wouldn't even pick up the phone or call us back. They would just leave us short on the floor.
Berkeley East has racked up so many serious quality issues that regulators say it requires special oversight to protect residents' health and safety, and dropped it from an overall 4-star rating to 1.
Labs weren't being reported in a timely manner. Patients weren't given their medications on time.
While Berkeley East operated at a loss, data from its most recent financial records show, overall, Aspen's facilities reported more than $27 million in annual profits.
I just feel like she suffered.
Maisha Morris's grandmother, Ruby Frazier, spent a month in this Aspen nursing home in Oakland after a fall sent Ruby to the hospital in November 2022. Maisha and her mother, Yolanda, say they watched as Ruby's condition quickly deteriorated.
My mom would push the button for help, and they wouldn't acknowledge her.
How often was she telling you this?
Every time. All the time.
One visit, Ruby, who was bedbound, began gasping for air.
I said, would y'all please call the ambulance? No, we're not going to call. I said, yes, you are.
Emergency room doctors diagnosed Ruby with pneumonia and severe sepsis. She had also developed these bed sores on her heels. She died 6 months later. The Morrises are now suing Aspen, alleging it knowingly and deliberately understaffed and unfunded the facility to maximize profits. Aspen denies the allegations.
They just didn't care about my mom.
The Biden administration has been trying to crack down on nursing homes by forcing them to disclose more information about their owners. But David Grabowski told us there needs to be further scrutiny of where taxpayer money is flowing.
Does Aspen have particular investors? There's no ability to peel that back with the federal data.
My mother-in-law wasn't the only one who felt ignored. On one visit, her roommate said she couldn't find staff to change her.
I have no idea when she's coming back.
Your neighbor said she has to go to the bathroom, but the nurse said she had to go to lunch.
Yeah,
Are you surprised?
yeah, that's a typical answer.
Aspen Skilled Healthcare declined to comment for this report. It recently replaced managers at Berkeley East and has reported staff levels that exceed state and federal requirements. In a statement, an industry lobbying group said, "We support financial transparency and accountability, but says these issues distract from others like chronic government underfunding and a growing worker shortage." As for my mother-in-law, she's doing better now. She says she stayed at Berkeley East as long as she did because the physical therapy, which was contracted out, was very good. Back to you in the studio.
Lisa, thank you.